Imagine standing in a silent hospital room. The air is thick with the smell of antiseptic and fear. In your hand is a thin glass tube. You know that if you make the slightest mistake, if one tiny blood vessel tears, one wrong movement, you die. And yet, you do it anyway. Because this isn't just an experiment, this is an obsession. This is the story of Werner Forssmann, a man whose fascination with the human heart would blur the lines between genius and pure madness. To understand this story, we need to travel back to the 1900s. Germany was still haunted by the scars of World War I. 2 million young men had been killed. Another 4.2 million were wounded. A total of 19% of the male population had become casualties of the war. But the suffering didn't end on the battlefield. At home, civilians struggled under the weight of the Allied blockage. Malnutrition spread through the population. Starvation became a real and often fatal possibility. Then came the collapse of the German currency. The mark lost all value. Savings disappeared overnight. Poverty spread like a disease. By November 1923, $1 was worth 4.2 trillion marks. And just when recovery seemed possible, another disaster arrived. In 1929, the Wall Street crash shook the world. American banks demanded repayment of loans from Germany. Suddenly, there was no money. No money for bread, no money for milk, and certainly no money for outrageous experimental medicine. People were cautious, institutions were rigid with every penny spent, and medicine feared the unknown. In Berlin stood a respected medical institution, the Kaiserin Augustin Victoria Haus. The facility focused heavily on infant death, health and medical research. And by 1929, it had become an important centre for studying blood circulation. It was here that a young doctor began his postgraduate studies. He was only 24 years old, and his name was Werner Forssmann. He had just received his degree from the University of Berlin the previous year. At the time, medicine was advancing rapidly, but one organ remained almost sacred, untouchable: the human heart. Hidden behind ribs and muscle, it was seen as a forbidden place. Attempting to pierce it was considered reckless, even suicidal. Doctors had only one desperate method during a cardiac collapse: intracardiac injection. Sometimes, very rarely, life could be restored. But the procedure was terrifying. Puncturing the heart wall could damage the coronary vessels and cause catastrophic bleeding. Because of extreme risk, surgeons waited until the very last moment before even attempting it, and that hesitation often cost the patient their life. Forssmann began studying the heart obsessively, its vessels, its pathways, every branch of its circulation, until a disturbing thought formed in his mind, a question that most doctors would never even dare ask. What if the heart could be reached through a vein? What if a thin tube could travel through the body's blood vessels and arrive inside the heart safely? But in 1929, technology was limited. Funding was non-existent. How could he even test such a dangerous idea? Then he began to look around. Hospitals already used urethra catheters, thin flexible tubes designed for other procedures. He had a tool. Hospitals also had radiographic equipment and fluorescent copy machines. He had a way to see through the body. And the autopsy suite allowed experimental study. He had test subjects. He now had everything he needed. After experimenting successfully on a cadaver, Forssmann decided to attempt something no one had ever done before. The first living experiment would be performed on himself. Inside a dimly lit hospital room, the young doctor prepared. He instructed a colleague to puncture the vein in his arm with a large needle, then to slide the lubricated catheter through the cannula and into his vein. The tube began moving, deeper and deeper, 35 centimeters. Forssmann could feel every pulse of his own body, every tiny movement. One wrong turn, one burst vessel, and the experiment would end in death. His colleague panicked. He refused to push the catheter any further, and the experiment ended. But inside, he knew he'd almost reached the heart, and that was too close to stop. 1 week later, he tried again, only this time, alone. He disinfected his wrist and attempted to cut into the vein himself, but inserting the large needle with one hand proved nearly impossible, so he changed his approach. Instead, he cut into the vein at his left elbow. This time, the catheter slid forward effortlessly, further and further, until the entire length had disappeared into his arm, 65 centimeters, roughly the distance from the elbow to the heart. Had he made it? He tried again, but this time, the catheter met resistance near the subclavicle vein. Then suddenly, a strange warmth spread behind his clavicle, at the base of his neck. The vagus nerve had been stimulated. He began coughing. A violent cough could move the catheter, tear a vessel, and cause fatal bleeding. But Forssmann didn't stop. He wasn't finished. For the next attempt, he brought someone with him, his sister. Not as a medical assistant, but as proof. Her job? To hold a mirror. Forssmann once again threaded the catheter through his vein while standing before the hospital's X-ray machine. His sister held the mirror so he could watch the X-ray screen behind him. Slowly, the tube advanced from his arm, under the clavicle, across the chest wall. Then it curved downward where the jugular vein met the center arteries. And finally, the catheter had reached his heart. For the first time in history, a human had threaded a catheter into their own beating heart. But proving it wasn't easy. The X-ray department was far from the operating room. To reach it, he had to walk up flights of stairs, with the catheter still inside his heart. Later, because early imaging couldn't capture clear pictures of the right heart chambers, he performed the procedure again and again, injecting contrast material through the catheter. At one point, the chemical spread through his circulation. He suddenly felt dizzy, his mouth grew warm, but the image, blurry and imperfect, finally showed the catheter reaching the heart. After 8 experiments on his own body, he presented his discovery. The reaction? Shock. His colleagues called him reckless, irresponsible, a lunatic. He was mocked, threatened with dismissal, even shunned from the medical establishment. Eventually, he abandoned the research and retrained in urology. Then, history swallowed the world again. Germany descended into political chaos that led to World War II. Forssmann served as a medical officer on the Western Front. Eventually, he was captured and became a prisoner of war. When he was finally released in 1945, he returned quietly to civilized life and resumed work as a urologist alongside his wife. For years, his discovery remained largely forgotten, until 2 researchers in America began exploring the same idea. André, Cournand, and Dickinson Richardsons at Columbia University redefined cardiac catheterization into a powerful diagnostic method. The technique transformed cardiology, and suddenly doctors could measure pressures inside the heart, study blood flow, diagnose disease without open surgery. The procedure that once seemed insane became standard medicine. In 1956, the world finally recognised the man who had dared to try first. The 3 men went on to win a Nobel Prize for medicine. The young doctor once called a lunatic was now a Nobel Prize winner. Forssmann died in 1978 at the age of 74. His story remains one of the most unsettling in medical history. A man alone in a hospital room, a knife, a catheter, and the terrifying decision to use his own beating heart as the experiment. Forssmann's legacy is a warning and a testament, because sometimes the line between genius and madness is only one heartbeat wide.